Welcome to the program. I'm your host, Neil Howard. Thank you for joining us for another segment. We're going to be speaking with Marilyn C. She's joining us here as a stage 4 lung cancer survivor to talk about her treatment journey with immunotherapy, a little bit on how she dealt with the stigma and misinformation associated with her disease, and a little bit about the importance of lung cancer screenings. Welcome to Health Professional Radio, Marilyn. Thank you for joining, and nice to meet you.
Nice to meet you also. Good morning to you.
Well, let us in on a bit of your life. What is it that you do? What were you doing when you were diagnosed?
When I was diagnosed, I was an IT person, and I was able to work for 2 years after being diagnosed. But then after that time, I did step down.
When you were working after your diagnosis, was that without any treatment whatsoever, knowing that you had stage 4 lung cancer, or did things become, you could no longer work?
The reason I stepped down, I was doing treatments every 3 weeks at that time.
Okay.
But the reason I stepped down was chemo brain is real. I've heard about it, but it's very hard sometimes when you're dealing with public and you have to keep, be able to carry a conversation with them, but you can't get your words together.
Mm-hmm. You were diagnosed with non-small cell lung cancer. Is that correct?
Yes.
Were you aware of non-small cell lung cancer before your diagnosis?
I was not. I was not. You hear people have lung cancer, but I've never heard small cell or, anything of that sort until, I became quite educated once I was diagnosed with it.
So what types of symptoms were you suffering from that prompted you to seek medical care in the first place?
I was never suspicious of having it. I get blood work done every 6 months as a wellness care. And it came back, my liver enzymes were a little elevated. Mm-hmm. 30 days later, they did another blood work on my liver enzymes. And at that time, I told him my brother had passed away several years ago from liver cancer. So they decided to do a ultrasound and found fluid around my lung, and that's what got the ball rolling.
You said that you were going through treatment. What type of treatment were you receiving? And did it begin immediately once you were diagnosed?
No, every 3 weeks is my treatment.
Okay.
I have done Keytruda from start to yesterday was my 60th treatment.
How long did it take before you started seeing any results?
By my second treatment, I could really tell a lot of difference. Plus, they had to drain fluid from my lung. But after they drained, the Keytruda made it to where they were able to measure the cancer, the size, see it exactly, where before it was just a white mark.
So it defined the tumor, making it more treatable?
Yes. Yes, it did.
What about some of the challenges with the treatment? Keytruda is, we hear a lot about it. What about some of the side effects that you personally dealt with?
To be honest with you, I've had no side effects.
Great.
To me, anybody can get Keytruda, go for it. Because, before they, cracked down with the COVID and that, whoever went with me for my treatment, I treated them to lunch afterwards. We go out to lunch right afterwards. So I've been very, very blessed with this.
You said before the pandemic put restrictions on moving around and things of that nature. How has this pandemic affected your ability to remain on your treatment schedule, or has it?
It had not bothered my treatment schedule. I did get COVID at one time, and that did, take me away from treatments. But other than that, no, I go by myself now because nobody's allowed to go with me. Mm-hmm. But the nurses keep me entertained. They're great at Cleveland Clinic.
Yeah.
It's just nice to have somebody with you, and like I said, go to lunch afterwards and that, but unable to do so right now.
With having someone with you, as you said, prior to the pandemic to, take out to lunch and be there with you during your treatments, what other types of support groups were you introduced to, or did you find doing your own research as a result of going through your treatment?
A lot of mine, I'm a Christian, so a lot of my support groups is through church. Mm-hmm. I know there are a lot out there, support groups. I do belong to, on Facebook, it's a private lung cancer site where, people will ask questions about, do you have this problem? Just different things of that. And I don't dwell on that a lot because I'm not negative, but I will try to help people and answer, and say prayers for them too.
So how is life working for you now? How are things going during your treatment? And, what's the next step on your journey?
Keytruda has worked wonders with me. Like I say, I'm a Christian. I mow my grass. I have a garden. I love to cook. I love to shop. And I will, as long as the good Lord is with me and continues to bless me. I mean, I've been married 45 years now, and I plan on continuing what I'm doing.
Well, is there any website or a group that you would like to direct listeners to who may be dealing with non-small cell lung cancer, or maybe a loved one who would need some information that could benefit from your experience?
I know when in the infusion centers, when I have my treatments, there is a lot of pamphlets, which I did get some of them, to read. And my doctor's she's been a great support person for me also. So, like I said, I just don't go out to support groups, I just stay active. Your doctor, like I said, you can go online for a lot of things, but just be careful because it will also bring you down too, and you don't want that.
Well, Marilyn, I appreciate you joining us here on Health Professional Radio this morning. Thank you so much for letting us in on a little bit of your life and your cancer treatment journey. And I'm glad that things are going well for you now.
Well, thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Marilyn C., Stage 4 lung cancer survivor. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.